once you start having these professions and these bureaucracies, you need to start expanding their remit. It's like any bureaucracy. And I think in public health, this is a large part of what we're seeing. You mentioned it in the autism issue that people are paid to be special needs teachers. And fine, there are some kids with special needs, but when you have a lot of special needs teachers, then you drop the threshold for the kids that have special needs because the teachers need something to do, and then you may start needing more teachers. All these ones are busy now, so we'll train some more teachers. We'll have more kids with special needs, and this is sort of inevitable. And gun violence becomes a public health problem. Racism becomes a public health problem. Everything's becoming a public health problem. So you're right. I think there's some political thing in here in that people worry about health. Health is very powerful psychologically. No one wants to be sick. No one wants to die. So when you start talking, as we saw in COVID, about risk and about health, then you can change people's behavior. You can get people to follow you. And so public health, not as a profession, but as an area of work, has always been very susceptible to this. So, the European fascism lent very heavily on public health, on the idea that certain ethnic groups were spreading disease, that, the sort of eugenic industry in the United States and North America, where it was very strongly, it was public health schools that sort of wanted to improve the human race by mass sterilization and so on. And these are all, it's a very powerful tool to use for politics. But I think where it has gone really wrong in the last decade or two is because it has become, there are just so many people in the field, and speaking as one of them. So health and climate is a big thing in my area of work, and I'm, to a large extent, a malariologist. I've worked a lot on malaria in the past. There's a big push now, and there's articles in the Lancet and so on about malaria getting worse because of climate change. And the evidence for this is extremely thin. Malaria is getting worse for other reasons. It's getting worse because of the mosquitoes are getting resistant to the insecticides that are on bed nets. The parasites are getting resistant to the drugs that we commonly use. There's some issues with diagnosis, and poverty's got worse through COVID and other means, and malaria goes with poverty. Climate change has made almost no difference to malaria. There's a little bit of extension of malaria to higher altitudes in mountainous areas like Papua New Guinea and Ethiopia. But, where it's predicted to make a difference in the temperate areas where, it'll spread further north back into Europe and south, they're the countries that are eliminating malaria successfully. So, but yet there's there's huge funding now for malaria and climate change. Not because there's good evidence, but because there's a whole industry now developing around health and climate that needs to be fed. And you need to find reasons for feeding it because there are a lot of people employed there. So, so we are seeing, you inevitably, these issues become bigger problems. I don't think this is completely divorced actually from where we started, which is around autism either. And the whole idea of when you have a lot of people whose sole existence is on fixing kids, then you find reasons in the kids to be fixed.
If you liked this video, check out the full interview. Also, don't forget to hit the like button, subscribe, and click the bell icon so you get notified every time a new video is uploaded. Thanks for watching.